In today's episode of the Resilient Back, we're going to look at how people with chronic low back pain can successfully build a bridge from where they currently feel stuck at to where they want to go. So let's dive right in. So if you've been dealing with chronic low back pain for some time now, you've probably tried a bunch of different options to try to get you out of pain. And a common pitfall that we see is that people will work with a physical therapist or a back rehab specialist program, whatever it is, and they don't actually get to their desired goals, their desired activities, whatever it is that they really hold valuable and that they want to get to, that they just never find themselves in that final destination. So what we're going to talk about today is why that occurs and what are some strategies that can actually bridge that gap from where you are to where you want to be. And so we're actually going to use a little bit of an analogy or visualization here. So I want you to picture that you are standing on the edge of a cliff and it's a deep canyon, and on the other side you can see the other cliff side. And on the other side, you can see, And on the other side, you can see, people running and they're hiking, they're playing with their kids, they're chasing after their dogs, playing soccer, anything and everything that you can imagine that would bring you joy in your life, that's what's going on the other side of this canyon. So to get to the canyon, there's only one way. You have to actually build a bridge to get over to that side of the canyon. So in this case, you are trying to find someone who's going to help you build that bridge. So in terms of back pain, a common approach is to seek out the advice of a physical therapist or a rehab specialist to help with your lower back pain. And you are starting to work with this person and you're starting to get excited. You're like, okay, I'm finally going to see some answers. I'm going to work with somebody who's going to actually get me to where I want to go. And so you start going. Let's say you stick with this rehab approach for 4 weeks, 6 weeks. You're going twice a week, you're working with this person, and they're giving you some stretches, they're giving you some core exercises, they're trying to target various aspects of your core and your back to try to improve your strength and help decrease some of your pain. And then at the end of that trial, 4 to 6 weeks, let's say, you are still fairly limited, and the person that you're working with says, okay, well, that's all I have for you. And, or maybe you're out of insurance visits at that point. So, that's all we got. So, good luck and hope you see less pain. And I recommend continuing on with doing these, core exercises, the plank, the glute bridge, and if you keep doing that, you'll get to where you want to go. And then they leave. And then you're standing there and you're realizing, well, I want to be over there with those people that are running and jumping and they have all the fun over there. That's what I want to do. But this person built you a bridge that got you maybe a third of the way or halfway. And then now they're gone and you're stuck there and you don't know what else to do. Now, many clients that we talk to, that they are very motivated, at least at some point. And so they try that first bridge, it didn't work. So then they go to another therapist, rehab specialist, or maybe they see a chiropractor or somebody, and they say, yeah, I'm going to help you out, stick with me, 4 to 6 weeks or maybe a little bit longer. And you're going to get to all the things that you want to do. You're not going to have any back pain. And they promise you all the results that you want to hear. And so you say, yeah, let's do that. And then they start working with you and trying to build that bridge to all the things that you want to do. And then after that trial of care, they say, okay, that's all I got. And then the person's like, well, wait a minute, I'm still not where I want to be. And then they say, okay, well, maybe this didn't really work out, or maybe you need to try to combine some other things with what we're doing. But that's all I got for you. Good luck. And then they leave. So now you have another bridge that's built, third, halfway across, not to where you want to be. And the cycle repeats and repeats. Is this starting to sound familiar for some of you? I mean, it's not uncommon for the clients that we talk to have done this approach, 6 times, 10 times, where they've tried to find the person that's going to take them all the way across the bridge. So what's going on? Well, there's a couple things that in some cases, the people that they're working with are just purely not experts in treating lower back pain conservatively, that they don't know how to actually build a person up and progress them through meaningful exercises and get them into strategies that are going to help get them to the activities that they want to do. So some of that is just the therapist's fault. They just don't have the training, they don't have the expertise to be able to do that successfully. Another issue is that sometimes there's these bridges that were built and a patient does, or a client does one thing, and they're all in on this one thing, and then it doesn't work. Then they go all in on this one thing, and that doesn't work. And many cases, if clients can work with somebody or find a program where they're actually able to use the best methods from all these different areas, then that actually will successfully build that bridge and get them to where they want to be. And then another barrier, and one of the last barriers I'll speak about today, is that sometimes it's just a matter of a commitment and accountability piece. So sometimes there are providers that do have a plan, but then patients get frustrated. Patients are thinking, hey, I'm doing more of the same here. It didn't work in the last time I worked with this person, so I don't think it's going to work now. I'm still in pain, I'm struggling, and then they drop off of care, and then they are no longer working towards their goals that maybe that therapist or maybe that program does actually build them up towards, but the accountability, the commitment, and also the communication between the client and the provider that they're working with just isn't there. Because sometimes when people are really struggling and they are starting to lose sight of what their goals are and where they want to go, that is the most important time to really lean into some coaching and say, hey, this is how I feel, this is what I'm currently up against. And then that gives an opportunity for the coach to say, okay, thank you for telling me, now let's work on these things. Or maybe that's a completely normal experience right now and you just have to push through a little bit right now. But working with somebody where they have, or where there's the opportunity to have constant feedback and constant progression, is going to make sure that you are seeing success every step of the way. Okay, so I'd love to hear your thoughts. So if you have any questions, please put them down in the comment section. Have you worked with providers where you've experienced the same type of thing, where you just make it about halfway across that bridge and you're unable to fully get to the things that you want to get to? So yeah, I'd love to hear what you think about the video, but stay tuned. We're going to keep posting some of these resilient back videos on a weekly basis, so you can have more of an understanding of our mindset and our overall philosophy of helping people with chronic low back pain.